known anyone that has cancer or thought, what if? Well, I never thought I knew anyone that has cancer until my aunt told us that she had breast cancer. Now, we didn't know how to handle it, what it came with it, or anything at all, or how to even support her or help her in this. Today I'm going to be informing you on what surgery breast cancer patients have an option of, the treatments that there are for this cancer, and how it affects the people diagnosed going through therapy. When my aunt first knew about this, we knew there were two kinds of therapy, like two types of surgeries, but we didn't really know of what they really truly were. We didn't really go deeply into it, or how it even affect her, and how we would have to be there for her. The two types are that I'm going to be talking about are lumpectomy and mastectomy. The two types are, the first one is lumpectomy, and from Hodgkin's, she explains that this surgery is that it removes the tumor within the breast that preserves most of the breast, and that one is this one right here, and they basically just take wherever the tumor is and they leave the rest of the tissue on. The second one is mastectomy. The entire breast is removed, not just the tumor. You may decide to use prosthetic breast after you have healed from the surgery, says Hodgkin's. And after surgery, one or two patients, they go through therapy, and this it depends what you actually decide to do. If you decide to remove the whole breast, there is a small chance that you might not have to take any type of chemotherapy or anything like that, because if you do, the only way you will is if it reaches the chest of the wall, the wall chest, because it reached to a certain point where it can go anywhere else in your body. Now, if you just take the little tumor out, that's different. You have to do it because you might have cancer cells within your body. And as well, the therapies that they go through this are radiotherapy, hormone therapy, or chemotherapy. And a picture of that to show you guys. Okay. Now, radiation therapy is a special kind of high-energy beam to damage the cancer cells. These high-energy beams, which are invisible to the human eye, damage the cell DNA. Over time, radiation-damaged cells are the path of its beam, normal cells as well as cancer. Breastcancer.org has that information if you guys want to go ahead and look more of what radiation therapy does. Now, hormone therapy, I know a lot of you guys don't really hear of. And hormone therapy is a cancer treatment that remove your hormones or blocks their actions and stops cancer cells from growing, explains the National Cancer Institute. And lastly, the last therapy that there is between choosing of the three is chemotherapy. Now, breastcancer.org informs us that chemotherapy treatment uses medicine to weaken and destroy cancer cells in the body, including cells at the original cancer site, any cancer cells that may have spread to another part of the body. Now, I saw this therapy and I experienced everything that they go through and how it really truly affects. Now, my aunt, at first, she decided to just have therapy where she just removed the tumor. After I saw how the therapy was taking a toll on her body, she couldn't even take it anymore, that she had to re-go and do surgery and remove the whole breast. That's how bad therapy really does affect the person that has this, and this is why when doctors talk to the patient about this, it's something that you have to decide, because it's something that's going to change your life drastically, whether you take therapy or not, or even emotionally, a woman to just remove a whole breast, they have to be emotionally prepared for it, and their family has to be there for them and know what their families, person that they're going through, with everything that it carries with it, and just be a big support for them. Now, I'm going to talk to you about many of the symptoms that you get from these therapies, because a lot of people don't really know everything. So I'm going to inform you about this. And radiation, breastcancer.org tells us that it has hair loss, skin pain, red burning skin, increasing skin coloring, fatigue, difficulty or pain swallowing, nausea, and vomiting. Now, hormone, on the other hand, there's hot flashes, changes to your period, less interest in sex, painful joints, mood changes, tiredness, and I got this from Cancer Research UK. Now, lastly, chemotherapy. WebMD Medical References says there's loss of appetite, nausea and vomiting, weakening and fatigue, mouth soreness, hair loss, weight gain, premature menopause, lowered resistance to infection. In conclusion, I have talked to you guys about breast cancer, what 2 types of surgeries these people go through, what they have to really truly think about in deciding on what to do, as well as the therapies, which options they have, and what these effects they have on their body. Now, if you know anybody at all that has breast cancer, just know that they really do need your support. They can't do it by themselves. They need you. And as well, when you go get your doctor checkups, even though you think you might not have anything, you might want to check yourself out, because this is the 2nd top killing cancer in the United States. And this as well is for the men, because men as well do get breast cancer. It's not just women. Thank you.
All right. The use of the personal example with your aunt I thought was fine. Your goals very general in nature, but there's a good preview what the content's going to be. The content is presented very well. There's a variety of information that you suggest. One of the things that we're going to talk about a little bit when we do the persuasive speeches in citing information, it's usually clearer if you give the source citation before you give the quoted material, because it's easier then to tell where the quotes material starts and where it's you versus where it's the quoted material, and you're usually post-citing the material, so sometimes it's a little confusing. It wasn't a big deal, but that'll be something that we'll want you to do next time. I thought that you did a nice job starting off the speech without being behind the overhead, talking to the audience, trying to get us engaged, and then moving the overhead into play when you actually needed it. Turning the lights on and off, that was probably a good idea, because then you're not hiding in the dark while you're giving most of your speech. You're only turning it off when you need it. I appreciated that effort that you put in there. Your gestures, sometimes they're a little bit limited, because for a lot of the speech you are holding the cards with both hands, but you're not doing that all of the time, and so there were times when you seemed a little bit more natural talking to us, and there is that tendency to sometimes rest your hands on the overhead machine when it's sitting right there. So it's a little bit of a crutch, but it wasn't something that was too distracting. I thought you seemed very animated when you were speaking to us. Your eye contact is usually consistent, but again, sometimes you're looking at the notes a little bit more often than we would hope. Not bad, just someplace that you could work on things. Same thing with your voice. I thought that you projected pretty well. You've got good variety in your voice. I think you could use your range a little bit more, maybe a little bit more energy here. The one thing in the presentation that I think could have sold it a little bit better is some energy in your voice, maybe pacing it a little bit more. It's a little lethargic, and if you picked up the pace a bit, I think it would come across more effectively. All right, thank you.